Hello everyone, welcome to my channel. Today I'm going to talk about different salivary gland reactive lesions. Now, in case you have missed my previous classes in oral pathology, you can always check out the playlist that I'll link at the end of this video. I've covered till here, I've covered developmental conditions, mucosal lesions, and connective tissue tumors. And right now we are at salivary gland diseases, and we are going to cover reactive lesions in today's video and benign and malignant in the next video. So let's get started. So let me just change the color. Yes. So salivary gland lesions, first we are going to study about mucus extravasation phenomenon. So mucus extravasation phenomenon and mucus retention cyst are used simultaneously, but actually they have very mild difference. This is nothing but accumulation if there is any blockade of salivary glands and you see any cyst in the lower lip, it is called as mucus extravasation cyst, and if it is in the upper lip, it is called as retention cyst or ranula. Okay, it can also be seen in the buccal mucosa, and this can also be seen at different parts. Now coming to necrotizing sialometaplasia. Necrotizing means and look at this lesion. This looks very similar to squamous cell carcinoma, but it is just mimicking it. This is not carcinogenic. So here what happens is there is lack of oxygen and this tissue gets abraded and an ulcer is formed, and it is believed due to trauma, surgery, or LA. Now coming to mucus retention cyst, like I have explained previously about mucus extravasation cyst, here there is a blockade of salivary duct by a salivary stone, also known as Sialo. Okay, now this is relatively common in the floor of the mouth, palate, buccal mucosa, and upper lip. And it is known as ranula when it occurs in floor of the mouth, and it heals within 6 to 10 weeks without treatments. And it actually mimics carcinoma, but this is not any cancer. Now coming to maxillary sinus retention cyst. Maxillary sinus retention cyst or pseudocyst can be only seen in panoramic radiograph. You cannot see it normally, and this is mainly due to the blockade of sinus salivary glands, or there might be focal fluid accumulation of sinus mucosa. The lesions are asymptomatic and it requires no treatment. Now coming to infectious sialodentitis. It can be caused due to virus or bacteria. Viral infections like mumps can affect parotid glands, and cytomegalovirus can affect, and it can pass through infants through placenta, so it is a transplacental infection. Now, bacterial infections that are common are usually Staphylococcus and Streptococcus. Coming to types of salivary glands. Salivary glands are 3 types, major salivary glands. You can see parotid gland, submandibular gland, and sublingual gland. Parotid gland makes 20% of the total saliva. Submandibular gland makes 80% of the total saliva. And wherever these salivary glands exits, wherever the salivary glands exits, if there is any blockade, then that leads to formation. There is focal accumulation of fluid and there will be formation of cyst. Okay. Now, salivary glands are classified based on the saliva they produce. Now, they are classified into 2 types. One is serous type, mucus type, and another one is seromucus types. Serous types means they give amylase, which helps in digestion of starch. Mucus gives mucin, which helps in lubrication, and seromucus means they have both serous types plus mucus types. Now we have covered the submandibular gland exits through Wharton's duct, and sublingual gland that is present below the tongue exits through Rebenus ducts. Now, sarcoidosis. Sarcoidosis, here, this is sarcoidosis. This is mainly a chronic granulomatous disease, and the cause is unknown, but it is believed to be caused due to bacterium called Mycobacterium. which causes tuberculosis. So you can see this in tuberculosis patients where they have pulmonary infection, which can also be seen as an oral manifestation, where you can see that there are some granulomas. Granulomas are nothing but macrophage infiltrates, which causes organ nodularity and loss of parenchyma in that area. And how do you diagnose this? Through biopsy and some tests. In the patients where calcium is more, they are said to be hypercalcemic, and you check them and you identify them through ACE, angiotensin converting enzyme, and serum chemistry. And for lungs involvement, you check for chest films, and for bone involvement, you check the radiographs. Now coming to Sjogren syndrome. Now, what is Sjogren syndrome? Sjogren syndrome is nothing but it is a chronic lymphocyte-mediated autoimmune disease. It is a lymphocyte-mediated autoimmune disease. And they are of two types, primary and secondary. Primary mainly affects the tear glands as well as the mouth, that is salivary glands, whereas secondary affects eyes, mouth, as well as another autoimmune disease, which is usually rheumatoid arthritis. So here, dry eyes is called as keratoconjunctivitis sicca, and dry mouth is xerostomia. And here you can see dry eyes, dry mouth, plus rheumatoid arthritis. And how do we diagnose? By taking biopsy of the salivary gland and by checking the lacrimal function. The test is called Schirmer test, and by checking rheumatoid factors, anti-nuclear antibodies, and then Sjogren syndrome A, Sjogren syndrome B. The cause is unknown, but we treat the symptoms. Patients are at risk of development of lymphoma, as it is a chronic lymphocyte-mediated autoimmune disease. Now, because of the dry mouth, there is more complication of development of cervical caries. So let's revise once again. So in the reactive lesions, we have mucus extravasation phenomena, which is seen in the lower lip in the form of mucocele. Necrotizing sialometaplasia is nothing but there is ischemic necrosis occurring mostly in the palatal salivary glands, which might be triggered due to trauma or surgery. Mucus retention cyst, when it is seen in the upper lip, it is usually seen in the upper lip. Salivary glands might be blocked because of a salivary stone that is called as silolith, and it is called as ranula when occurs in the floor of the mouth. Heals by 6 to 10 weeks without treatment. Maxillary sinus retention cyst or pseudocyst, which is common in radiographs, and it is occurs because of the blockade of the sinus. Infectious Sialodentitis can cause due to different bacterial and viral infections. The viral infections affecting salivary glands are mumps and cytomegalovirus. Cytomegalovirus can transfer from mother to the infant through placenta. Bacterial infections are streptococci and staphylococci infections. Salivary glands, the major salivary glands are parotid glands, submandibular glands, sublingual glands. We have thousands of minor salivary glands, and these glands which produce saliva, 20% is produced by parotid gland and 80% by submandibular gland. Wherever these glands are exiting, if that is blocked, then there will be reactive lesions. Okay, so how are salivary glands classified? They are classified into serous, mucus, and seromucus type. Serous type secretes amylase that helps in digestion of starch. Mucus gives mucin, which helps in lubrication, and seromucus means both mucin and amylase are produced. Now, sublingual gland is situated below the tongue, and it exits through Rivinus ducts, and submandibular glands exits through Wharton ducts. Any blockade will lead to cysts. Minor salivary glands, there are thousands and thousands, and it is only visible when there is any inflammation. When, suppose in this diagram, you can see an inflammation, and that's because a minor salivary gland has a focal fluid accumulation. Now coming to sarcoidosis, it is a chronic granulomatous disease of unknown cause, but it is said to be associated with a bacteria, that is mycobacterium, that causes tuberculosis. So the patients might present pulmonary infection and they might have granulomas, which cause organ nodularity and loss of parenchyma over there, which can be diagnosed with the help of biopsy and chest x-rays. Bone involvement can be seen through radiographs, and if there is more amount of calcium, can be seen through serum chemistry, and we find ACE also. Jogren syndrome is mainly a chronic lymphocyte-mediated autoimmune disease, and it is of two types: primary Jogren syndrome and secondary Jogren syndrome. Primary Jogren syndrome occurs where you can see there is drying of eyes and drying of mouth. And drying of eyes is called as keratoconjunctivitis sicca, and dry mouth is xerostomia. Whenever there is a dry mouth, there is more chances of infection of caries because bacterial accumulation will be more. Secondary Jogren syndrome consists of dry eyes, dry mouth, as well as rheumatoid arthritis. Diagnosis, mainly it helps in assessment of salivary function. Salivary gland biopsy is done. And for assessment of the lacrimal function, Schirmer test is done, and we do blood tests where we check for rheumatoid factor, anti-nuclear antibody, and Sjogren syndrome A, Sjogren syndrome B, and causes unknown, but the treatment is symptomatic. Patients are at risk for development of lymphoma, and there is always complication of cervical caries associated with the dry mouth. So that's all for today. Thanks for watching, and stay tuned to my channel for more videos. And in case you have liked this video, please do like, share, and subscribe. And if you have any questions, you can leave your questions and I'll be happy to get back with the answers. Thank you.